Okay, we are going to get started. Good morning, everyone. My name is Mariza Mendoza, and I am a news reporter here in San Antonio, Texas. I work for WOAI News 4, San Antonio, and KABB Fox 29. I've been a reporter here, well, not in this market, but I've been a reporter for about 20 years and have covered different health stories over the years and informing viewers about the importance of health, education, and employment and how all of it is just interconnected. And this panel today, this virtual panel, is the power of education and employment and improving overall health. So I'm so happy to be here moderating this event and welcoming everyone who is participating. We have such a wonderful panel of very educated and well-informed people. I just want to let all the attendees know that this panel will be recorded. All participant lines should remain muted, but attendees are encouraged to submit questions through the Q&A chat feature. And again, we will do our best to make sure that all of the same types of questions are grouped together so that our panelists will be able to answer all of them at the bottom of the hour. I want to thank today's host. Her name is Dr. Naomi Alvarez. She is the Associate Vice President of Behavioral Health for Molina Healthcare of Texas. Dr. Alvarez, thank you so much for joining us.
Thank you, Mariza. Appreciate it. Good morning, everyone, and welcome to all of our guests who are joining us this morning. On behalf of Molina Healthcare of Texas, we're looking forward to this important conversation. Education and employment opportunities are inextricably linked to health and overall quality of life. Graduation rates, healthcare options, and even life expectancies all have a direct correlation on this foundation of education and secure employment. To improve the health of entire communities, it is imperative that we first address our education system and workforce, ensuring that every Texan has the tools to thrive in their communities and secure healthier outcomes for themselves and their families. Molina Healthcare of Texas is glad to serve as a partner to organizations that are working to break the cycle of poverty, open new pathways to employment, and build healthy foundations for every Texan for generations to come. Some of those organizations are represented on our panel today, and we're looking forward to this robust conversation with all of our esteemed panelists. To kick off our conversation, I'd like to first introduce today's keynote speaker, Representative John H. Bucy III from the 136th District in the Texas House of Representatives, which includes Northwest Austin, Cedar Park, and Round Rock. Representative Bucy is the Vice Chair of the House Elections Committee and serves on the House Select Committee on Healthcare Reform and the House Committee on Higher Education. He is also a small business owner and started an organization that serves 200,000 public school students across Texas in athletic, academic, and arts competitions. Through his work and his experience in the legislature, he is an expert on today's topic. Thank you, Representative Bucy, for being with us today.
Thank you, Dr. Alvarez. Thanks for that introduction. I'm excited to be here with everyone. I want to thank our host, Molina Healthcare of Texas and Molina Cares. When I first ran for office back in 2013, a race I ran for and lost pretty badly, but I ran largely because my predecessor didn't support Medicaid expansion. And it's something that was just shocking to me because it's a way that we can truly help so many working Texans. I still believe that failing to expand Medicaid has been one of the biggest failures in Texas over the past decade, which we've seen real negative impacts on healthcare in this state because of our failure to do so. And it just continues to be a priority of mine. We're back in a special session, our second one so far, starting today, this hour. So I'll go from here up to the House floor. Where so far we're going to be working on tax cuts. So we'll see if the governor adds anything on healthcare to that call. But, I do want to talk about kind of the theme here a little bit and what we did this session, serving on the Select Committee on Healthcare Reform and the Committee on Higher Education. I had a front row seat to some very exciting progress we made this past session to improve access to technical and higher education, workforce development, and healthcare. It was kind of unique having both those committees and the experience and how it ties into, y'all's conversation today. I've been a long believer in the power of education to build strong families, strong communities, and ultimately resulting in a strong Texas. And that's, I think, so many of our goal here is to how do we help the people of this state and help this state simultaneously thrive. Over the interim leading up to this past session, I had the privilege of serving on that Select Healthcare Committee that then became part of the regular session as well. One of the things that really stood out to me with that committee was talking about the unconscionable rate of uninsured children in this state. And so I walked away from it with a kind of a bill idea, and that's what we've referred to as express lane eligibility. It's been done in a few other states, but basically what it does in a nutshell is it takes away some of the bureaucracy to help eligible but unenrolled kids get on health insurance. There's 400,000 in the state of Texas, we believe, eligible and unenrolled kids. So this would have streamlined that process, express lane that process. Basically, when someone signs up for SNAP, which we see higher rates of participation, it would have almost auto-enrolled them. They just have to check a box and they get their health care. So we were trying to streamline the bureaucracy. Over the course of 6 months to a year, we would have seen estimated 400,000 kids get this health care. This is something that the House prioritized, House Bill 1599. We passed it out almost immediately. One of the first bills passed out of the House. It's sent it to the Senate. The Speaker made it part of his Healthy Families priority list, but unfortunately the Senate sat on the bill until the second to last day. The Lieutenant Governor didn't even refer it until the second to last day. Never got a hearing over there. The last day of session, the Speaker doubled down on his commitment to get this done next session. So we're going to keep fighting. I think as so many things go in the Texas legislature, these are multi-session progress that we try to make and make the case for why these policies matter. But this is a big one. Another area that I really wanted to focus on this session in healthcare was improvements to 211. In addition to working in the healthcare space, I'm also vice chair of the IT caucus in the Texas legislature. And it's just amazing. If you're not familiar with 211, it's kind of the front door of Texas for so many people that interact with government, state agencies, and resources. And it's not really been updated in 20-something years. So we need to work on that. And so we did a lot of modernization policies around that. And then wanted to work on the IDD waiver list and Medicaid reimbursement rates. Most of these things passed out of the House, lots of bipartisan support, but unfortunately they went to the Senate to die, as where, as a House member, we say where most of our good ideas go to die, but we'll keep working at them. We did have some really positive wins on the healthcare front this session. House Bill 12, providing for 12 months of postpartum Medicaid coverage. It's a huge win, something that has been worked on for a decade. And it's taken too long, but I'm happy that it got done. We also saw Senate Bill 379 pass. This provides for sales tax exemption for feminine hygiene products, adult and children's diapers, baby wipes, maternity clothing, breast milk pumping products, to name a few. And these are things that, are essential to life, and to get those taxed where it will no longer be taxed, I think is so important to helping people of Texas. Another bill that really stands out as a win this session is Senate Bill 26, which expands behavioral health innovation grants, and Senate Bill 2193, which creates a pilot program for collaboration between small business and FQHCs to provide for more healthcare access. So there's a few other, I think, positive things. And I think a few other things I want to highlight, just vital on the healthcare and the education space, were tied to our budget. We had a $321 billion record budget this session. With these special sessions, we're still figuring out how we're going to spend some of it. Some of the areas where we really missed is supporting increases for public education. That will be on future special sessions. So we're still going to be having those conversations. But we did some great stuff in the healthcare space and in the higher education space. $2 billion to raise community care workers' hourly base wage. It's up to $10.60 an hour. That's still way too low, but we're going to take progress where we can get it. $207 million for HHS rate increase, $447 million for women's health programs, that's an increase of $160 million over current spending, additional $178 million for rural hospitals, including increased funding for labor and delivery, which is so important in this state, increasing funding for DFPS by $548 million, nearly $100 million to expand community-based care, $219 million for foster care rate modernization, $9.4 billion in the budget, plus another $2.2 in the supplemental budget for over, for $10.5 billion for mental health care. Some of those things, specifically mental health community hospitals, help with state hospital operations, community mental health grant programs, and for some modernization and tech around this too. And then we look at the budget and look at what we did with higher education. And I think if you weren't paying super close attention, it would surprise you that I think, this really was a higher education session, so much of it good. And then I think a few steps backward with some of the culture wars tied to higher education. But we saw an additional 1.1 billion in funding for higher education under the current program. But we also established the Texas University Fund, which will support University of Houston, UNT, Texas State, and Texas Tech. It's $3 billion to increase having more research higher education institutions. We want to compete with states like California, where the UC system has, 6 or 7 major universities of research. And so this will take us up to 6 major universities of research. We also put a lot of money into all of our other schools to help them continue to improve. We had major breakthrough with almost 700 million for our community colleges and another billion for technical workforce operations. And why this matters into this is between our investment in community college, investment in our research universities and our technical colleges, we are increasing the pathways from education to the workforce. And I think that is so vital to y'all's conversation around having a good job, taking Texans, educating them in different avenues and pathways, and getting them into the Texas workforce, keeping them here and keeping them local is so important for the growth of this state. And this was a major step forward in higher education investment. I was just really proud to be a part of that. I won't get in the weeds, but on what I think the negatives on higher education were, but we take these major steps forward this time, but we also saw cultural wars around tenure and DEI. And I think, that's frustrating that we're taking major leaps forward, but then we're taking steps backwards when it comes to trying to recruit and be open and get the best professors and students. But I still, I look to our progress and I'm excited about what we did there. I just think how it's going to help the job pipeline and getting people into great careers and pathways in the workforce to find the success that y'all are going to jump into in this panel even deeper about why that helps improve, their life and success rate. I think we still have a lot of work to do when it comes to childcare, something that's important for the workforce issue. Early childhood intervention is vital to keep working at. I'm going to keep fighting for express lane eligibility. And I think all of these issues we talked about and these challenges in the healthcare space, the single most important thing we could do, and we've already said it, is pass Medicaid expansion in the state. Let's bring home your tax dollars that you send to the federal government. Let's bring them back to help Texans. And let's make sure, because once you have healthcare, once you have insurance giving you access to healthcare, that leads to your ability to be in the workforce, to be successful, to have a successful family. And that comes first. So we got to get that done. And I think that's a great transition into y'all's conversation. But I truly appreciate the opportunity to be here with you today and to just share a little bit from what's going on here at the Texas Capitol.
Thank you so much, Representative Bucy. I mean, you've highlighted so many different things that you all are working on. We appreciate you for taking the time today and spending it with us and sharing what it is that you are fighting for and fighting for us. I think it's so important to let people know that there are 400,000 children who are uninsured. That is an astronomical number that should not even be one, but here we are. So thank you for bringing up so many different subjects and keeping us informed. I'm going to bring it back to Dr. Alvarez and Molina Healthcare of Texas, along with its Molina Cares Accord, for bringing together today's panelists. I want to introduce first Kerry Ballast, Deputy Division Director of Workforce Education, Texas Workforce Commission. I'm also going to introduce Dr. Ann Barnes. She is the President and CEO of Episcopal Health Foundation. Joy Burris, BA CESP Program Specialist, Project Search, and Cathe Dykstra, Chief Possibility Officer, President and CEO of Family Scholar House. Thank you so much, ladies, for taking the time and informing us on how important it is, where healthcare, employment, education, all of it is all so interconnected. According to the National Institute of Health, employment can increase life expectancy up to 10 additional years, while unemployment is associated with a 63% increase in the risk of mortality. Now, Dr. Barnes, can you please set the stage for us a bit and share your view on the current health landscape across Texas and how social and economic status play a huge role in overall health? Thank you. Thank you again for joining us.
Yeah, I'm happy to be here, and thank you for the question. So we have decades worth of research that indicate to us that health insurance is an important driver of health. It accounts for about 20% of a person's health. The other 80% of a person's health is derived from factors that occur outside of the healthcare setting or outside of the doctor's office. And so these are things like food security, housing security, safe environments, and as we're going to talk about today, employment, a living wage, and education, high quality education. We know that in order for us to all live our healthiest lives, we need to have our clinical care needs met, but we also need to have our social, environmental, and economic needs met for us to all have an opportunity to live our healthiest lives. It was alluded to that life expectancy is tied to employment. There's also great mapping data that shows that life expectancy is tied to your zip code. And so there is a 30-year spread between some zip codes in Texas and other zip codes in Texas. So while we are prosperous in many ways, there are communities that are struggling in terms of living their healthiest lives. And when we overlay maps about food security, housing, high quality education, and employment, they all overlay perfectly with those life expectancy data, which lets us know that there are root causes that affect our health, and that's really where we have to pay a lot of attention. The one thing that I think is interesting and folks on the call may not know is that this year, for the first time, the Health and Human Services Commission of Texas released a groundbreaking action plan that demonstrates their commitment to addressing non-medical drivers of health. And so those for this particular plan are housing, transportation, and food. But what I think it does is that it demonstrates to us that the conversation about health in Texas has really changed to be about total health and not just healthcare. And this step by Medicaid and CHIP through Health and Human Services Commission demonstrates that they are open to looking at these root causes of health. And I think that bodes well for all social determinants of health, including employment and education, which we'll talk more about today.
Well, and I appreciate you bringing that up because there are so many factors that go into health. And again, it blows my mind that 400,000 number of uninsured children. It all starts when everyone's a baby. So clearly we need to rectify it from the beginning. I'm going to bring in Cathe. A big part of Family Scholar House's mission, easing the burden on single parents who are finishing up their post-secondary education and providing a safe living situation for themselves and their children during that process. Can you please talk about how eliminating certain stressors makes an impact on participants and their families?
Absolutely, I'd love to do that. So we start from a whole family-centered approach, and our staff works with the families with whatever their needs that they present with to identify their strengths in those needs and how we can utilize those strengths for the areas where there are gaps. And when we look at needs, we break that into two categories: the tangible needs and the intangible needs. Now, affordable housing is tangible in that you can tell when someone has it. So safe, affordable housing is a tangible need. We work with our families everything from safe, affordable housing to getting connected to Medicaid, to having a medical home, to addressing food security. Taking the weight of that off of a single parent for her or him and their children allows them to take a deep breath and exhale. Intangible needs are harder to identify. And it used to be harder for us to quantify until we launched our database. Our database tracks 238 fields of information for every household we serve. So things like low self-worth or concerns about being a good parent or past trauma that has been experienced or not feeling like you're able to manage your own household or personal finances. Because we use the Arizona Self-Sufficiency Matrix and the very objective scoring there, we're not only able to work with a participant to assess where they are, but to track their progress and remind them that they are the authors of their future and that the progress they've experienced is their own success. With our children, we use ages and stages questionnaires. So we're all working towards seeing that betterment that comes from having those needs addressed. From the data, we know that from intake to the first 6-month reassessment, our participants report a 35% increase in feeling competent in their parenting skills. You can imagine how that improves their own self-worth and their ability to focus on their education and their work. We also know that our children saw an 81% increase, technically a decrease in the amount of monitoring and interventions needed in their development year over year. So that's the same children retested. And lastly, this coaching model is ingrained in the Family Scholar House program model. We want to make sure that our students recognize their own success. You get a grade in school, you get an evaluation in your job, but you don't usually have a score in life. And using the self-sufficiency matrix, we're able to help them see their own progress in all of the things that matter to them.
Well, and I think it's such an important conversation that you're having with these parents, because I don't think, income level, it has no boundaries where it comes to the intangible that you're talking about, which is, am I a good parent? Am I doing enough? And that weighs heavy, especially particularly on women. So you always carry that with you. And even though you can, right, thank God you can do the food, you can do get the help that way. But mentally, if you're, as a parent, mentally, if you don't have that support, or you feel like you don't know where to turn, it affects your children, and it becomes a domino effect horribly. So let me bring in Kerry. Can you touch on the Texas Workforce Commission's role in ensuring that underserved populations across the state have access to employment opportunities, and what work is being done today to connect these populations with careers they can have long-term success in? I know here in San Antonio, we work a lot in trying to get the workforce pipeline to stay here. So we try to do a lot of educational, we start in the school, then they work through college, and hopefully they just stay within the city.
Exactly. And a large presence there in the San Antonio area with our Workforce Solutions Alamo offices. So just to give you a little bit of background on how workforce typically works, we have offices throughout the state that we refer to as our Workforce Solutions offices, and they're nestled into workforce areas that are watching and responding to the needs of that area. What employers are saying that they need, what we see on the future, and making sure that we have a strong pipeline. I think the other important connection to make here is that many of the customers who walk into our offices are also in need of nutrition assistance. They're also in need of temporary assistance. And the way our system is organized is that those individuals, while receiving that assistance, are also working through the Workforce Solutions offices to either, number one, start a career, or number two, might be in a career that doesn't have a long pathway. It might stay in a low wage job. And sometimes the job is new skills and a new pathway or the next and better job within a career pathway. Right now, the focus is on, and always thinking about, for these individuals who need this education and training, is let's put them in opportunities in which they're working and earning a wage while they're learning, as opposed to, be trained first and then get the job. Let's bring the two worlds together, learn and work at the same time. We often call this a earn while you learn model. And it's wonderful for sustaining individuals who are looking for employment and needing to learn new skills, brush up on academics, sometimes even finish a high school diploma or complete a high school equivalency that we know as a GED. So when we talk about this earn while you learn model, this is what we would call very often work-based learning. And from our commission, we're really encouraging work-based learning, saying that the best of both worlds is happening. You'll see this often in apprenticeships, in which an employer hires someone and they're making a good steady wage as they're being educated and trained on the job. We also see this in internships. We see it in just simple on-the-job training, and it seems to be one of the most sustainable models. When we look at apprenticeships in particular, an individual in an apprenticeship position not only sees wage increases as his or her skills increase, but also are very often put on a pathway that is leading them to some of the highest paying jobs in the state. For instance, a master electrician, a master plumber. In this kind of weather, HVAC is a high demand job, and we want to put individuals there.
Well, and it's great to know that it's always continuing the education, because things are changing so fast now. The landscape for education this is the hot new thing right now, but then right behind you is something else. So it's always good to know that there is always resources there to help people get to the next level. Thank you so much, Kerry. Joy, people with disabilities are certainly one of our most vulnerable populations and often overlooked when it comes to unemployment opportunities. Now, in your experience, how has gainful employment impacted the health and lives of Texans with disabilities?
Thank you for having me be a part of this panel. It's really a privilege to be able to do that. And there is such a direct link between jobs and longevity has been discussed. And there's direct research and an evidence-based correlation to health, income, and the overall quality of life for people with disabilities, not only for them to work, but for them to work among people without disabilities as well. And so in Project Search, we have many examples of this. We have longevity of jobs, we have career advancement, opportunities for independent living. Recently, a Project Search graduate from Dallas purchased their own home. So, we're seeing things like that happen. It's just so inspirational. Opportunities to meet new friends and partners even. We have some examples of actually marriage with our Project Search graduates. And so it's just seeing them live their lives as we are all living our lives is such a important thing. The other thing that we're seeing is stamina and improved health. We have a woman at Cincinnati Children's Hospital. She's in her 40s and she has Down syndrome, and she's been working over 20 years at Cincinnati Children's Hospital. So just seeing those, she's working full time and she's really doing a great job. And so we're really excited and we really celebrate those examples when we're able to see those. Since I work at Cincinnati Children's Hospital with Project Search, we actually get to see some of those first Project Search graduates continuing their employment, advancement in that employment. And so it's just it's a great with all of our partners here in Texas, Molina Cares and Texas Workforce Solutions, we are able to really impact Texas with our program.
I love the fact, Joy, that you give these folks a voice, and their voice is able to be heard, because I think they are very much more capable than people give them credit for. So thank you so much for giving them that voice and giving them the opportunities that, you know, maybe they thought they weren't there, but they were more than capable to be there. They just needed a little direction and guidance. So I love that. Now back to you, Dr. Barnes. The Episcopal Health Foundation's mission is to address non-medical root causes of poor health in underserved populations. Can you please share how your organization identifies these issues and works to improve the lives of Texans you work with, and how has working together with the community partners made an even bigger impact?
Yeah, happy to answer that question, Mariza. I did want to just, as I've listened to the other amazing speakers, just wanted to sort of make the observation and draw the through line that when people receive education and then are able to move up into employment that provides a living wage, then you see things like food security, housing security, living in safe neighborhoods. All of these things then impact their health ultimately. And with a lot of jobs, you actually get health insurance as well. And so I just didn't want to miss the opportunity to draw that through line at how foundational education and employment are to a person's health. Now to answer your question, one of the things that Episcopal Health Foundation prides itself on is listening to the community. So there's lots of research that tells us about non-medical drivers of health or root causes of health disparities. But it's really when you ask the community about what they're struggling that you really begin to understand where interventions are needed. And I'll give you an example. We worked with a federally qualified health center in Fort Bend called Access Health, and the clinic was very focused on improving diabetes in the patient population. And they kept talking to patients about ways to improve diabetes. And the patient said, what's really important to us is having safe places to walk. We don't have sidewalks. And so when the clinic began to listen to what the priority of the community was, they actually had the opportunity to solve their own problem around diabetes. They joined the community in advocating for sidewalks in the neighborhoods. And there has been a massive overhaul in the presence of sidewalks in the communities served by Access Health. And that's really how change happens. Focusing on what's important to community members and raising their voice, and thinking outside of clinical care to whole person care and factors that are outside of the clinic walls.
And I'm sure those sidewalks encouraged exercise, right? Walking and simple things like that they won't be afraid to get hit by a car or things of that nature. So
absolutely,
little changes like that make a huge difference in people's lives. Thank you for sharing.
And they will probably impact the diabetes control rate as well, because people can exercise now.
Right, and then they can exercise with their kid who is biking or things of that nature. Absolutely. Kerry, following up on the question to Dr. Barnes about working together with community organizations, how does Texas Workforce Commission work alongside organizations in the state to address matters like equity, finishing education, technical training, and workforce development?
It's a pretty surprising answer. You know, when I started working at Texas Workforce Commission, I was amazed at how many ways we touch individuals in this way. But I'm going to go back to that individual who walks into a workforce solutions office. So, you know, first thought is training, additional education, a good job with a future to it, a sustainable wage. But in addition to that, the other part of this is looking at the other barriers in the way of that individual. So for example, does this person need childcare while they're on the job, while they're learning the job? And if yes, if they do, our offices are able to work with that parent or that family to arrange subsidized childcare while this individual is getting started in their new career. If the individual needs a little bit more stable housing, anywhere from homeless to being in a situation in which they're sharing housing with others or need more affordable housing, we're able to make references out into the organizations within the community to find that housing for them. In talking with these individuals, if we see opportunity to connect them with a college, and number one, just to get started on the education piece of it, but also while they're doing that, to also learn, go through workforce training. We do that too. So many of our, all of our community colleges will make referrals to them. And then also, you know, as that individual is doing that is we assist in the payment of that training and of that education to help them. So childcare, addressing any kind of housing needs, any kind of education needs, those are also on the list as we begin to work with our customers.
And those are big ones, because those usually are the excuses, right? Why people do not do this or cannot do that. So that is great that that is able to be handled. Cathe, many family scholar house families have experienced domestic violence, unstable housing, poverty, and more. How do these circumstances and family scholar houses services impact not only the parents enrolled in post-secondary education, but also their young children who are often enrolled in school and creating their own educational foundations?
Thank you for that question. Most of us cannot imagine trying to earn a degree or a credential, work, raise healthy children without having a safe place to live, safe and affordable housing. But let's just take a look at some of the data for our Houston program. 83% of our Family Scholar House single parents have experienced domestic violence as an adult. When you include experiences in the home they grew up in as a child, that percentage increases to 95%. In addition to completing the survey and tracking the answers from the Adverse Childhood Experiences Survey, what we all call ACEs, which for Houston, the average adult has a 5 out of on the 1 to 10 ACEs scale. We also track 9 chronic traumas that are evidence generally of major physical and emotional trauma that is often very sustained. These are big stressors. These include things like domestic violence, sexual assault, strangulation, murder, witnessing a murder, sex trafficking, labor trafficking, stalking, chronic bullying, and community violence, which is that experience of hearing gunshots day and night, and being afraid to leave your house for fear that you could be involved in some of the violence around you. 89% of our Family Scholar House Houston participants answered yes to at least one of those 9 chronic traumas, with the average being 4. And of 156 single parents, 3 answered yes to all 9. I mean, most of us can't even comprehend that level of trauma. I want to talk briefly about strangulation specifically, and this can be a difficult topic to talk about, but strangulation is a little bit different. A crime, but with strangulation, you can have a traumatic brain injury. And because of that traumatic brain injury, we find that our participants often then qualify for additional services from vocational rehab, additional accommodations in their education, and sometimes even in their work. 47% of the Family Scholar House Houston single parents that have experienced domestic violence have also been strangled, with 10% of them later being diagnosed with a learning disability. So having the awareness of that, it allows us to have a starting place to help people get the accommodations that they need. And all of these 9 chronic traumas are separate from the poverty and homelessness that 100% of our student parents have experienced. None of these experiences are easily overcome, and all of them take work. But when you have a coach and a guide and an advocate to work with you through that, plus art therapy and music therapy, particularly for our children, art and music therapy and even play therapy are a more meaningful way to reach them than talk therapy. Children do better when they don't have to just talk about it. They get to use their hands in that process. All of those things come together to address the trauma that they've experienced so that it isn't heavy baggage holding them back from all of their future goals.
Right. And the support, just being the support there is big for both parents and children. Joy, Project Search's expansion in San Antonio is an exciting opportunity to grow our pipeline of diverse local talent. What are some of the policies or services employers should consider providing to encourage applicants with disabilities and create an accessible workplace? Again, supporting that group that is more than capable to do a lot of things.
Right. We've seen the business partners really step up to provide a great accessible workplace. It's been great to see. Somebody mentioned something about work accommodations, and one of the neat things that we see in businesses across Texas is that a project search instructor or a skills trainer may come up with an accommodation for a certain individual. And the next thing you know, that accommodation either stays in the department that it was made or it spreads to other departments because the general work population can use it and can benefit from it. One that we all might be able to identify is instead of having something printed, in a size 11 or 12 font, 14 or 16 might be a little bit easier to read. So we're seeing an accommodation just that simple spread throughout the workplace. But business partners have implemented internal policies that really prioritize inclusivity, non-discrimination, and reasonable accommodations. So we're seeing that spread through really any business I've been connected with. And I support 9 different states. So many business partners have also established employee resource groups that really focus on disability inclusion and support. And that really spreads like wildfire if the leadership gets on board with that. They also are contributing to disability organizations. Texas Workforce Solutions is really a key partner in that. And they are really helping businesses learn more about diversity and inclusion for people with disabilities within the workplace. We've just seen a great service to different businesses through Texas Workforce, creating a follow-along job position. So at Cincinnati Children's, they have created job positions where any employee with disabilities has a follow-along coach. So if they are changing a department, or we had a few individuals that worked in the emergency department at Cincinnati Children's, they built a new emergency department, and there was time for adjustment, and there was support for that adjustment to those individuals that had been working in that job for a long time, but there were going to be big changes and they just needed time to adjust and that support. So Cincinnati Children's has been great seeing the need for that. Another thing that can happen is creating some kind of certification. Many of the Project Search programs look for certifications that the interns can earn as they're going through the program. And so that's another way that organizations can really help the individuals going through the process so that they can not only use those certifications within the host business, but they can take them out into the community and be better qualified for jobs out in the community. encouraging internship managers to give feedback, maybe through the typical business evaluation. That feedback, that honest and open feedback is really key to helping the interns going through Project Search grow, just like it is for any of us. If somebody tells me I'm doing a great job all the time, and then all of a sudden they say, you're not doing a good job in this area, if I would have known earlier, I could have corrected that. So that's a really important thing that we like to try to help train our managers and mentors on as well. Also, rethinking job requirements. If a job description quotes that it has to have a high school diploma and an individual has some type of other certificate showing that they did finish their education, can that be counted like a high school diploma? Work experience programs, can those be counted as making that individual have the qualifications for that entry-level position? So those things are things that employers can really do to help those going through these work-based learning programs succeed in the job market.
Absolutely. And for the employers, half the time it's just knowing that there are
Yes.
people there who are ready and willing to work. Dr. Barnes, how can identifying and understanding non-medical effects on health enable people to take charge of their health and build stronger futures? Could greater education of these social determinants help inform workforce policies and job training?
Yeah, I think everybody on this call can speak to the fact that when someone has social or economic needs or safety concerns, that they are not able to thrive. And so we all recognize how important addressing those things are, those non-medical things are, to someone being able to live a full and healthy life. I think that the conversation about non-medical drivers of health has changed in Texas. I think you see many more health systems and employers, frankly, recognizing and screening for social needs, knowing that that's going to impact productivity on the work side or health outcomes on the health system side. So I think continuing to elevate the conversation about how all of these factors affect someone's ability to be healthy is going to be critical for us to then begin to implement programs like the state is doing now, Health and Human Services Commission with their action plan. I think that is what it's going to take to begin to actually invest in meaningful ways in these non-medical drivers of health that are 80% of an individual's health outcomes. So I think we keep elevating. This panel is one way of doing that, about how these factors are really critically important.
Absolutely. And Cathe, last year, Family Scholar House opened their first Texas program with the organization's largest residential campus yet under construction in Houston. Can you speak to the real impacts you've already seen on your program participants in Houston and how the community as a whole thrives when parents succeed?
Yeah, absolutely. And we love our pre-residential program because it gets people ready for the housing that's coming and gives us an opportunity to share the importance of that work with others. Anecdotally, we have stories of single parents feeling more connected, more empowered to enroll and graduate from post-secondary education, feeling like they're better parents, feeling like they have a better access and more agency. But I love the data, and I think that's coming through in my comments. So taking a look at the data, in the most recent 12 months, Family Scholar House staff have worked with 156 households, providing 3,477 program and service interactions. 92% of those single parents that have been in the program for 6 months or more report that they have benefited from the staff support and the community environment created. So what do those benefits look like? We've seen an 88% increase in Medicaid enrollment, and an increase from 65% to 90% of families that have an identified medical home. Both of those things are very critical to their ability to focus on other things when their health needs are being met. Healthier people and healthier families mean healthier communities with greater workforce participation. With staff help, 73 adults have been able to apply for and enroll in government subsidy benefits such as SNAP and TANF and K-CHIP, leading to greater household income and stability. 57 participants have, with staff support, enrolled in post-secondary education. And while we've only had 2 graduates in this first 12 months, we know it takes a little bit longer to complete post-secondary education. We have 81 that are on track with their prerequisites to then enroll, and 36 who've been connected to scholarship opportunities so they won't have student loan debt. So remembering that this is a longer term program, we're expecting 21 more graduates by 2024. So this is exciting, not just for us, because we care very much about the work we're doing, but for each individual student parent that's doing this work. 148 households have received emergency financial assistance from Family Scholar House, totaling $7,436. I mention this because often the amount of emergency financial assistance needed to solve a problem is less than $50. And while that might be an unexpected expense for some of us, it can be a dead stop barrier for other people. So we are providing those supports as well. The most common fields of study for our participants who are pursuing a degree or a credential are social sciences, public services, and healthcare. And that's notable because they all want to be in a position to give back to the community that has helped them.
Well, and to reiterate what Dr. Barnes has been saying and the whole panel, right? It all starts from the beginning of health, education, then you find the employment, which leads to health insurance. It all is such a good thing. We're coming to an end, but I have a few more questions to ask folks. Joy, Project Search operates programs across the country. Are there any specific challenges you've encountered in the Texas market, and how we can begin taking steps to alleviate those obstacles to open the door to fulfilling careers for the disability community?
Well, I can tell you that Project Search in Texas has been highly successful because of Texas Workforce Solutions and grant providers such as Molina Cares. So I want to just, get that out on the table. Texas is one of our most successful states, actually, because of that support. But other ways is, it takes a lot of work to get the partners together and to get that that correct combination together to make a successful program. But I just can't reiterate enough that the hard work, Texas Workforce Solution provides us with a statewide coordinator that helps us coordinate those partnerships. And so I can't really say that there's a big deficit there, because there's not, because of the hard work. And I'm telling you, Texans rise to the occasion when they want something. It is just it's one of my favorite states because of that, because of their hard work and determination. When they want to help people and come together to help people, there is nothing that's going to stop them from making that happen. So that's all I got on that one, because Texas just really rises to the occasion.
Well, and I'm glad that you say that. I'm a transplant myself. I come from Illinois. So
Okay.
Texans it's part of their fabric to
Yes.
just really Texas tough, and they want to help their community. One last question.
I'm from Indiana, and my son lives in Texas, and I was sad at first, but I'm like, nope, that's the state he needs to live in, because he's got that same sense of determination. So thanks.
No, not a problem. I totally agree with you. I love it here. I've been here for almost 20 years, so it's been wonderful. One last question for you, Kerry. Can you speak a bit about the benefits to the Texas economy and on our individual communities when Texans are healthy and successful in their careers? And how does the Texas Workforce Commission envision the future of workforce development as our state's population continues to grow?
Happy to. So as you all are probably aware, we're in a period of amazing economic growth in Texas, and unemployment rates are very, very low. We're right below 4% at this point. I would tell you that the great news when we see this kind of growth is that when we work with someone, it's not necessarily to find a job, but it's to find the job, the one that's going to give the opportunities, the one that has growth, the one that's going to lead to something bigger and better every time the education and the skills and the experience increase. And so it's a great time to be someone living here in Texas. And I think word is getting out every day as y'all see our numbers grow. But industry and businesses are coming to Texas too. And that's creating more and more opportunities. And we're not only focused on the quick short-term solutions that individuals often need, but really giving some thought to and putting them on really promising pathways for the future.
Well, I appreciate that. That is all very, very good news. Thank you so much to all of our panelists. I want to bring back Dr. Alvarez to talk about Molina Healthcare of Texas and its view on education and impact on overall health and well-being.
Thank you so much. I would like to just share on a personal level that this topic is something that's very near and dear to my heart. I come from a family of educators, and in my own personal studies throughout graduate school, my research was on career education. And I know that my colleagues here at Molina share the same passion. And so I'd like to just share a little bit about the work that we're doing that really channels that passion into our membership. Just as we've heard this morning, we know that educational and vocational opportunities can lead to positive health outcomes. So we're working with some of the schools in our communities in a focus group type setting to get a better understanding of how we can support our younger members in being successful in their educational programs. I think having the opportunity to sit and listen to teachers and administrators voice their concerns and share their successes really helps us to determine how we as a healthcare partner can ensure that we're supporting not only those members, but their families, their schools, and their communities. We're working to implement school-based health initiatives so that children can have access to on-site healthcare without having to leave school, without parents having to leave work, so that they get that care that they need. We work with organizations in our communities that assist with vocational programs to help our working age members obtain meaningful work. And we also continue to add and seek additional partnerships with organizations like universities, medical schools, and dental schools. And we are so thankful to all of our partners in the communities throughout Texas that are willing to allow us the opportunity to learn from them so that we can in turn implement innovative programs that not only help our members get what they need, but to thrive. And with that, I'd like to thank our keynote speaker, our panelists, and our moderator for being part of the solution and sharing your perspectives with us today. These open conversations are key to making a difference for Texans and taking action to make our state and people who live here stronger for the future. If you have questions about our work in the state, you can visit molinacares.com. Thank you again so much, everyone, for joining us. Have a great rest of your day.
Thank you.